Hello everyone and welcome to the continuation of our topic from last week, which is your homeostatic and feedback mechanisms. For today, we will have your anatomical positions, the terminologies, and the vital signs. As we all know, the vital signs are the primary indicators of our health status. So in one of our performance tasks for lesson 1, it will be related to the changes in our vital signs. So without further ado, let's have first the anatomical positions. So anatomical positions class is the subject stands erect, facing the observer, with the head level and the eyes facing forward. The feet are flat on the floor and directed forward, and the arms are at the sides with the palms turned forward. So basically, the anatomical position shows or presents to us a visual context on how the bodies or the structures are being shown or being presented in the medical field. So usually, when we talk about anatomical position, the position is like this one on the picture. Okay, so again, the subject stands erect facing the observer with the head level and the eyes facing forward. And the feet are flat on the ground and directed forward with the arms at the sides with the palms turned forward. Okay? We also have class the directional terms. So words that describe the position of one body part relative to another. So why are we using such directional terms in the medical field? Because, for example, we cannot just say that our wrist is located on top of our fingers. Do kabalik-awat man siguro nga maghambal ta nakatungtong lang da ang aton nga wrist sa baba sa aton mga tudlo or sa aton nga mga palad. So that is why the purpose of the directional terms is of course to help the persons in the medical field to locate certain bodies in the human body or certain structures within the human body. Okay? So here are some of the directional terms that are being used in the medical field. First, we have the term superior. So superior are also known as your cephalic or cranial. So it means toward the head or the upper part of a structure. Magambal ta superior, ara siya sa babaw. Okay? So for example, the heart, ang aton nga heart is superior to the liver. Meaning, mas babaw ang aton nga heart kaysa sa aton nga liver. That is superior. Next, inferior or also known as caudal. So it is away from the head or the lower part of a structure. Meaning naman, ara siya sa dalom. Okay? For example, the stomach is inferior to the lungs. Ang tiyan ta kuno ara sa dalom mismo sang aton nga lungs. So that is inferior. Okay? Next, anterior or ventral. Nearer to or at the front of the body, meaning ara siya sa aton nga tubang. For example, ang aton nga sternum or aton nga breastbone. The breastbone is anterior to the heart, meaning ang aton nga breastbone ara sa tubang sang aton nga heart. Anterior or the front view. Next, we have your posterior or dorsal. So it is nearer to or at the back of the body, ara mismo sa likod. Okay? For example, the esophagus is posterior to the trachea. Okay? Magamba kita posterior, ara siya sa likod. Meaning ang aton nga esophagus, ara sa likod sang aton nga trachea. Okay? Next, we will have your medial. So, nearer to the midline or the mid-sagittal plane. Mismo ara siya mismo sa tunga. Okay, medial. So, for example, the ulna is medial to the radius. Di ba ang aton anatomical position is arms on the sides facing forward. So, magamba kita ulna. Ang ulna ta is this one, yung ari class. Pinky finger, ang bone niya ari dire. Sa amo nga side sa aton yung pinky finger is your ulna. Your radius is this one, ang bone niya ari dire. Okay? So, kung nagahumlad ang aton nga palad, ara sa tunga mismo sang lawas ta ang aton nga duha ka ulna. Medial, ara sa tunga. Okay? So the ulna is medial to the radius. Okay? Next, we have your lateral. So, lateral is farther from the midline or mid-sagittal plane. Maghambal kita mid-sagittal plane, ara siya mismo sa tunga. Okay? So, meaning, ang ato naman lateral is away, lateral is away from the middle line or your medial or middle line. Okay? So, for examples, the lungs are lateral to the heart. Makitaan siya sa layo, sa kilid, kag sa kilid, natungan sa ato nga heart. Layo siya sa ato nga heart. Natungan siya, pero layo siya sa heart. So, meaning the lungs are lateral to our heart. Okay? Next, we have the term proximal. So, when we talk about proximal, it is nearer to the attachment of a limb to the trunk or nearer to the point of origin or the beginning. Okay. So, that is your proximal. Layo, lapit siya. Okay, for example, our shoulder or aton nga deltoid, for example, is proximal to the neck. Meaning, lapit siya sa aton nga liog. Okay? Magamba naman kita ya distal. So, distal is farther from the attachment of a limb to the trunk, farther from the point of origin. Magamba naman kita ya distal, layo, distansya. Layo siya sa isa ka origin or ginhalinan sa isa ka part sang lawas. Okay? For example, the phalanges are distal to the carpal. Our phalanges is RD, di ba? Magamba kita phalanges, class, those are our fingers. Okay, your digits. Okay, so these are your phalanges. So, phalanges are distal to the carpal. Ang carpal tayo is our palad. Meaning, atuto siya sa layo, di ba? Kung gahumlad ang aton anatomical position, layo ang hara dito sa punta, sa pinakapunta sang edge ang aton nga lawas. So, digits or our nga tudlo or phalanges are distal to our carpal or aton nga palad. Layo siya. Kumbaga, ang aton nga direction is that kung ari ta di sa layo nga distance, palapit, okay, dapat nagapababaw siya, that is your proximal. Pero kung nagapadalong na naman siya palayo sa lawas, that is your distal. Okay? Next, we have the term superficial. So, toward or on the surface of the body. Ara mismo sa babaw lang gid or hapaw pababaw sa aton nga body. Excuse me. So, for example, the ribs are superficial to the lungs. Meaning, ara lang gid mismo ang ribs ta, babaw lang gid mismo sa aton nga lungs. Okay? So, hapaw ara lang siya mismo sa babaw itself. Okay? So, that is your superficial. And also, we have your term deep. So, away from the structure or the surface of the body. Ara naman siya mismo sa dalom. Ara lang gid siya mismo sa dalom or natabunan lang gid siya mismo sa likod sa isa ka certain body or certain body part or organ. Okay? For example, the ribs are deep to the skin of the chest and the back. Meaning, ara lang gid mismo ang aton nga ribs sa likod sang aton nga panit nga ara sa dughan. Deep, ara lang gid mismo sa likod. Okay? So, these terms are usually used in the medical field to locate certain body parts of the or certain structures or infirmities that can be observed sa isa ka human body. For example, nakatulon da biyang taang bata, piso. O nakatulon siya piso, nag-stuck diri mismo. So mamangkot ang doktor, where can we locate the coin nga gintulon sang bata? So mahambal biyang isa ka, for example, the radiologist nga naga-check sa mga x-rays. Mahambal siya nga, doctor, the coin can be located anterior to your vertebra, meaning sa tubang, anterior, tubang lang sa ating vertebra, and posterior to your rib cage, meaning ara sa likod sa ating rib cage. So, mas hapos, or it will be easier for the doctors to locate the certain coin or the certain structure or body organ when using the specific directional terms for anatomy. Okay? So, let's continue. So, again, here is a wider picture on defining or telling us the directions of the anatomical structure. Again, medial it is between the midline. Magamba kita midline sa tunga mismo. Okay? Superior sa babaw. Inferior, ara lang siya sa dalom. Okay? Next, proximal, lapit siya, pababaw sa ato nga lawas. And we have your distal, going down or the last part of a certain extremity. Okay? Farther, kumbaga farther. Magamalta proximal, nearer. Okay? Next, we have your we also have your superficial and deep, which is not in the picture. Pero magambala man kita superficial, ara lang siya mismo sa babaw, natabunan ng gawa. And deep, ara lang siya mismo sa likod, sa amo ng structure. Okay? So we will have a lots of directional terms on our live synchronous class. We will try to utilize the directional terms in locating our certain body structures. Okay? Sige. We also have class your regional terms. So it helps us locate specific body regions. For example, magamalong doktor, diin to siya ginsumbag, diin to nakita ng lagob. Okay? Hindi lang magambal nga, basta na sa ulo, dampi. No. In the medical field, they usually use the regional terms with their specific jargons or language. And these are just some of the language or the regions in which ginagamit on a certain profession in the medical field. For example, here's a picture class. Head. So usually, di na siya makitaan sa head, hindi na siya. So ginagamit nila is the cephalic area. So magambal ta gani skull, we have the cranial sa cranium mismo. Anyway, we will have more of the terms when we discuss the musculoskeletal systems. Okay? So for face, it is your facial area. So neck is coined as your cervical area. Hindi na magambal nga cervical, cervix. Hindi na siya magambag kita yung cervical, it includes the vertebrae on your cervical area. Ari sa liog mismo. Okay? For armpit, we have your axillary. For arm, we have your brachial. For the front of the elbow is antecubital. Ang ari di mismo, ang ginakwaan ta dugo sa mga medtech usually is your antecubital area. Okay? We also have your antebrachial or your forearm. This is your antebrachial area. Your wrist is your carpal area. Your palm is your palmar or volar. Next, we have your fingers. Your fingers are your digits or also known as your phalanges. Okay? Thigh, we have your femoral, coined into your femur. Okay, femoral. For the knee or the anterior surface, sa tubang mismo sa tuhod mo, ang gabukol, that is your patellar area. Nadus mo siya napila sa diin on the patellar area. Yan. Next, leg is your crural, and we have your foot as your pedal. We also have specific terms nga malocate man sa ato nga foot. Like for example, your ankle, we have your tarsal area. And we have your toes, same with your fingers na siya. Sa toes, we have your digits, your digital area, or your phalanges, or your phalangeal area. Okay? The top of the foot is your dorsum. And your great toe, ang imo nga kamalagko sa tiil, that is your hallux. Okay? We also have your pubis, your pubic area, or your pubis. Okay, sa pubic area na siya. Diin nagabutod dampid or nagahabok sa may pubic area. Okay. Next is we have your pelvis. Sa imo balakang, your pelvic area or your pelvis. Your groin, ang imo nga sa hita mismo is your inguinal area. We also have your navel or your umbilical area. Amo na siyang inutdan sang ato nga umbilical cord, ginatawag ng umbilical area or your navel. For abdomen, we have your abdominal, your chest, we have thoracic. For breast, we have your mammary areas. For breastbone, ginatawag siya nga sternal, coined into your sternum. Okay? Your chin is mental area, your mentum. Next, we have your oral or your mouth. Okay? Paano na siya ginainom ang imong nga bulong? Through oral route. For example, oral by mouth or oral. Next, we have your nasal, your nose. Your cheek, your buccal or buccal. Next, we have your ear or your otic. Makita otic sa dulunggan. For example, if you try to read the medications ng ear drops, may nakasulat na on otic medication. Otic, meaning sa dulunggan siya. Or otic administration. Okay? For eye, we have the orbital area or the ocular area. Your temporal area or your temple. And then we have your forehead, we have your frontal. Okay? So this is just for the anterior nga areas. So some areas also at the back have their own specific nga jargons or terms. For the base of the skull, ang sa likod, ang himod nga ulo dire, pinakalikod, that is your occipital area. Your shoulder blade is your scapular area. Your spinal column is vertebral. Back of the elbow is your olecranial or your cubital. So between the hips, you have your sacral area. And ang ato nga balikawang sa likod, that is your lumbar or your loin. And we also have your buttocks, that is your gluteal area. For regions between the anus and your external genitals, that is your perineal. Kumbaga, ang natungan gid mismo magbika kada, that is your perineal area. Sa anus, pakadto sa genital. Okay? We also have your popliteal, your hollow behind knee. Ang ginapilaan-pilaan, ginapala sang tuhod ta, that is your popliteal. Ang ginakuan, pag ginapulso na, popliteal area na siya. Next, we have your plantar or your sole. Dapa-dapa, that is your plantar area. Your plantar flexion, for example. And your heel, ang imong nga tukod, that is your calcaneal. Okay, so those are just specific regional terms for us to identify or to locate specific areas in the body. Okay, so in medical field, they also use the planes. Okay, so planes are your imaginary flat surfaces that pass through the body parts. Kumbaga, for those nga would plan to take up RadTech or radiologic technologist, one of the roles is to provide information of the body parts based on a specific plane ordered by the doctor. For example, nagpa-MRI da or nagpa-CT scan, gusto nila sang view nga naka mid-sagittal, for example. So maghambal kita sang mid-sagittal, it is the cut along the lengthwise or longitudinal plane of the body, pahaba ang tunga. So kung tungaon mo ning lawas, median or mid-sagittal, ang guwa ido amo ni. Do ka side view maging tunga. Okay? As dire siya mismo gin tunga, dinlantaw da ang part of the body dire. Okay? Next, we have your frontal or also known as your coronal plane. Ang chop-chop niya halin dire, paamo na. So anterior and superior ang cut. Tubang kag likod yung tunga. Okay, so that is your frontal or coronal plane, from the word coronal or your crown itself. Patunga siya nga pa, amo ni siya. Okay. Next, we have your transverse or your crosswise. Patunga gid siya mismo. Okay, or the cross section of a certain body. So it is divided into your superior and inferior. Kung sa frontal, anterior kag superior, tubang kag likod, ang sa diriya sa may transverse tunga ang babaw kag dalom. So usually, kung tungaon na siya in a transverse plane, amo naman siya makita mo sa imo nga, for example sa CT scan or sa MRI nimo. Okay, so this is your planes. We have the median, longitudinal on the middle, frontal, your anterior and posterior, and we have your transverse, superior, and inferior cut or sections, or the cross section. Okay, sige. So these are just some of the anatomical terms that are used in the medical field. We will have more of the exercises on our live synchronous class. Okay, sige. Let's continue. Now let's have the concept of your vital signs. So vital signs class is one of the indicators in which mabalanta kung may mga changes gid man nga gakatabo in a human body. So your vital signs class are checked to monitor the functions of your body. And it also reflects the changes in the function that otherwise might not be observed. So basi karon ang atong da nga tupad balay, nami lang da ang ngirit-ngirit, nami da ang lumpat-tumpat, tapos gulpi lang natumba, wala pilas. Nga basi deep inside niya, nagabatsyag na siya gali of a high blood pressure or an increase in the palpitation in the heart rate. So vital signs class are the very important indicators, kumbaga, of the status of an individual or the health status of an individual. Okay? Sige. First is we have your temperature. So body temperature reflects the balance between the heat produced and the heat lost from the body and is measured in the in heat units called your degrees. So your temperature class is divided into two kinds. We have your core temperature and we have your surface temperature. When we talk about core temperature class, it is the temperature of the deep tissues of the body. For example, your abdominal and your pelvic areas. So these are relatively constant. Maghambal kita core mismo ang imo ginya pinakasulod-sulod sa imo nga lawas. That is your core temperature. And we also have the surface temperature, which is being monitored usually in checking your vital signs. So this temperature is located on your skin, the subcutaneous tissue, and your fat. So this is your surface temperature and usually being checked. Okay, this is surface. So there are lots of sites nga pwede takwaan sa aton nga temperature. It can be on the mouth, on the axilla, o sa ilok. We have the rectum or sa anal area naton. Pwede man sa agtang or sa forehead, and we have your ear or sa dulungan naton. And if we don't have such extremities, for example, hindi ka pwede ma-checkan sa baba kay nakapasak man dabi ang imo nga mechanical ventilator or ang imo nga gapaginhawa sa imo. Tapos wala ka pagibeya kamot kag tiil. So chances are we can also have the sites such as your esophagus, your pulmonary artery sa heart, and sa bladder or ang ato niya pantog. And usually these sites, your invasive sites nga ginahambal ta is being monitored ang ilang nga temperature with the use of a catheter. Okay, ginapasulod mismo sa lawas. But always remember, ang pinaka-safe sa tanan are the non-invasive nga sites. Okay. So these are just some of the examples of your non-invasive nga mga thermometers. May ara kitang usually sa mga magsulod kita sa SM, sa mga malls and establishments, we use your forehead thermometers. Excuse me. So in other places, they also use pacifier nga mga thermometers for babies. And way back before class, gagamit kita sang mercurial nga thermometer, kaso wala na siya ginagamit subong because mercury contains toxic chemicals that may harm the body. Okay. So sa bata, usually sa mga babies, we use the auxiliary one. Pero sa mga newborns, gina mismo bago bata, ang usual naman niya sites are those nga ara sa rectum. Nidasok na siya sa buli sang bata to obtain the core temperature. Tandaan ta lang, the rectal temperature checking, ang rectum is one of the most accurate nga mga results in checking the temperature. Kaya mismo the core temperature, ganyan gina-check niya. Okay. And the safest one is your axilla sa ilok. Okay. So there are a lot of factors that influence class your temperature. Number 1, age. The more nga gatigulang isa nga tawo, chances are ang adaptability sa temperature changes. Okay? Circadian rhythms. Magamba kita circadian rhythms. This talk much about the sleeping patterns of an individual. And usually, pag the person has lack of sleep or changes in the sleeping patterns, usually there is also changes with the temperature of or the adaptability of a person in relation to temperature. So always remember to sleep regularly, especially sa 12 a.m. to 2 a.m. nga time range ang ato nga daily sleep. It's because within sa amo na nga time class, our circadian rhythm is active. Ang dapat rapid eye movement na nato ay nagakatulog na kita para maka-adjust kita sa change in the body in the temperature. Kung usually nagapulaw ka, naga-change man na ang variations nimo or adaptability sa temperature. Okay? We also have your sex and your hormone levels, especially sa mga girls during your menstruation or during sa ato nga menstruation. Okay? So what can you notice? There are hot flushes na nagaplang init ang lawas. It's because of the imbalance in your estrogen and progesterone levels during the menstrual phases or the menstruation itself. Okay? Next, environmental temperature. So kung the more nga tugnaw ang imong palibot, chances are ang aton nga lawas ginasigi-sige pag ipainit para maka-adjust ka mismo sa amon ang ikatungnawon. Okay? Type of clothing. Basi karon nag-check ka da temperature mo kay nga balalo grabe gid sa akon ka init gali kay ang bayo mo tag tatlo ka patong sang jacket. Okay? So also have to check your clothing. Muscle activity. Remember, the more activity nga ginahimo sa lawas or movement, chances are there is too much utilization of your ATP resulting to production of heat. Okay? Body position. Hala ka init sa akon, grabe yung akon init sa lawas kay gali ka pangarumbot kada bilog nga adlaw. Okay? The more nga pangarumbot ka, ang imong core temperature nga balibot-libot na nagainit lang nagainit. Okay? Emotional states. So, the more you are sad or feeling hopeless, sometimes your mental health also influence the change in the body temperature. So, we have certain diseases. For example, if you have infection. So, during infection class, tandaan ta lang, when there is infection, there is increase in your white blood cells. So while there is an increase in the white blood cells, chances are it also heats up your body. Nagahilanat ka because it increases your immune system in the process of infection. Okay. And of course, anxiety and stress. O, di ba? For example, kung kabatsyag nga pamasunon ka, di ba ka pala mugnaw ka? And that is an example of anxiety and stress. Okay, there is also a change in the temperature due to that one. Okay, so these are your factors influencing your temperature. Excuse me. Now let's have some terms related to the alteration in the body temperature. So let's discuss these terms one by one. So medyo damo siya. Okay, first let's have your afebrile. When we talk about afebrile, there is the absence of fever. For example, I am afebrile. I don't have a fever. Okay, normal lang akong temperature. Next is we have your pyrexia. Magamagita pyrexia. It is also coined as febrile or also coined as fever. Okay? Gahilanat ako. I have pyrexia. Elevated body temperature. Next, we have the term hyperpyrexia. This is an extremely elevated body temperature reaching 41 degrees and above. So, grabe, naging init mo. Hyperpyrexia. Okay, so in hyperpyrexia, usually, ginabantayan tada is seizure. Basi gulpi lang magkirig, bala kung tamaan ka init ang lawas. Variations in the temperature, nag-effect sa imong nervous system. We will have more of that in the nervous system. We have also your hypothermia. Okay, by the way, class, hyperpyrexia can also be considered as your hyperthermia. Okay, Next is your hypothermia. So, below 34.5 Celsius. Nagplanugnaw ikaw. That is hypothermia. Nubuin mo temperature. We also have the term crisis or flush, sudden drop of the temperature to normal. So, gulpi ka lang nag-init-init, tapos amat-amat siya nagnubo. Nga nagnubo, balik sa normal. That is your crisis or flush. Next, we have the lysis or the gradual drop of temperature to normal. Okay? So, gradual, amat-amat lang, lysis. Next is we have your heat stroke. This is the critical increase in the body temperature, 41 to 44 degrees Celsius, receiving from exposure to high environmental temperatures. Especially sa mga areas having the mga Middle East ba lang areas having too much heat or sa mga sandstorms, usually the heat range nagalabot 41 and above. Same also here in the Philippines, especially during summer season, taman-taman ka init, nagaka-heat stroke ang iban. And sa mga winter naman yung mga areas prone to having the winter season, they experience this one naman called your frostbite. So, freezing of the body surface areas in extremely low temperature. So, usually, ano makitaan sa tao nga ka-frostbite, gagit ang ilang mga kamot. It's because ga-dry up ang mga blood vessels nga rata ang gatugnaw. Nagasulo ang dugo, nagagit-om, kay wala na passage ang oxygen, kay nagtig-an na. Kisa, pwede mautod ang kamot. Nagabiring-biring, hasta wala na siya may mabatsyagan. Okay. Frostbite. Do hugot tadi. Okay. So, that is your frostbite. So, in checking your temperature, we have lots of sites. Again, we can use this one. Kung may ara sa mga panimala inyo, we will have this digital thermometer. So, pag on mo, pwede mo na siya ibutang sa imong ilok, pulton mo lang mag-beep, and then, voila. May result ka na on your body temperature. For this route, I don't advise you to use this one ha, but pwede niyo siya, okay? As a source of your temperature checking. For oral, all you have to do is to place the tip on the either side of the frenulum. Maghambal kita frenulum sa dalo mismo sa imong dila. Okay? So, kita nyo niya ang punta sa inyong thermometer. All you have to do is to clean up this one using a cotton with alcohol or your normal saline solution. Ang daw tubig na sa dextrose. Butan nyo lang sa cotton and then wipe this one. There is a tip in a circular motion pakadto dito sa punta sa iyang lawas. Okay? Then place it on the back of the tongue, sa dalong dila. And then wait for the result. Basta naka-on, tapos mahulat ka lang sa beep. Okay? Next. Ari, hindi na siya advisable ha sa mga tigulang gyud. Base, pwede lang siya sa mga bata, pero kung wala na gid sites or hindi man pwede sa baba, pwede man ang rectal area. So, all you have to do is to wear your clean gloves lang and then insert it on the rectal area. Allow lang siya nga pag ginhawa dalom and to insert that one. Okay? So, this is only performed by medical professionals. But if you are trained to do so, then you may. Okay? So, this is the one nga gina-advise ko lang sa inyo sa ato nga activity. Auxiliary lang, sa ilok talang ibutang. So, kung basa ang ilok, trapuhian na. Tapos, ang mabutang sa imong temperature dira or thermometer. Okay? Kung medyo may ikasarang, kung may ara kami sa timpani ka thermometer, so ibutang na siya sa dulungan and then press on and then it will release lang the result for the temperature. So those are your methods in checking your temperature. By the way, we will just present a presentation or video presentation on our live class on how to obtain those. Okay. Next is we have your pulse or yung ato niya pulso. So pulse is a wave of blood created by contraction of the left ventricle of our heart. Okay, so kung nagapump ang ato niya heart, especially on the left ventricle for the distribution of the blood, chances are may ginahimo siya nga wave, lugabalod-balod, and that is our pulse or ato niya pulso. So we have two types of pulse. We can have the peripheral or the apical ones. Peripheral is a pulse located away from the heart, for example, in the foot or wrist. So we will check your pulse using this one, the peripheral pulse, specifically on the radial area. Okay. And we also have your apical pulse. So it is a central pulse that is located at the apex of the heart. Mismo sa punta sang ato nga heart, that is your apical pulse. And usually in the medical field, magpakonsulta kung kisa kay doktor, amo na siya ngiyang ginagamitan sa stethoscope ang ato nga apical pulse monitoring. Okay? Pero kung magpa-check up, usually kung mga nurse ang nag-inspect sa imo, they will have the peripheral one. Hindi rin kamo gina-check. Okay? Actually, class, we have lots of sites for pulse checking. And these are just some of pinaka gina-check gid ng mga sites for pulse checking. We have the temporal, ang diri sa ato nga temple mismo. We also have the carotid, ang diri sa ato nga liog. Make sure lang kung mag-check kita sang carotid nga pulse, hindi ta na siya pag i-massage. Okay? Do not massage your carotid nga artery. The more na gina-massage mo na siya, chances are there is stimulation of one of your nerves. Okay? That results to what we call as Valsalva maneuver. Anyway, kung sige mo na stimulate, chances are ma-dilate na siya ang imo nga blood vessel diri, and chances are manubo imo BP ang iban malipong. So never massage your carotid areas. Apical area, of course, sa punta sang imong heart mismo, located on the 4th to 5th intercostal space of your clavicular line. Magamba kita 4th to 5th intercostal space. Punta lang ang space sa aton nga mga ribs, 1, 2, 3, 4, 5. Mga mata left, ara sa aton nga left area. And then mid-clavicular. Clavicle or your collarbone sa tunga mismo. Ara da siya ang imong nga apex or apical pulse. We can also have your brachial. Gagina, na-mention tani siya sa inyong anatomical or directional terms, your brachial. We have your radial. We also have your femoral, ang diridampi. Your popliteal sa likod sang imong nga tiil, sa imong nga knee mismo. Sa dalom sang tiil ta, we also have your posterior tibial and your dorsalis pedis sa tiil niya mismo. So these are the usual peripheral sites na gina-check sang aton nga pulso. So here are just some of the factors that may influence the pulse rate. So first, we have the age. So usually, kung ang edad bata pa, chances are mas dasig ng ilang heart rate. Okay? Exercise. The more na bira-bira ka da, bira-bira man ang heart mo pump. It's because to compensate the need of your body to have the oxygen. Medications. Basi karon mag-inom ka da nga grabe magpapalpitate. Okay? Pwede na siya. Position changes. Your positioning changes may also affect your pulse rate. For example, gahigda ka da. Pag bugtaw mo, gulpi ka lang yung nagtindog, chances are ma-adjust gulpi ang imong heart sa pagtindog mo. Chances are there is a decrease or either an increase on your heart rate. Temperature may also affect the pulse rate. Your stress, emotional stress or anxiety or fear. Kung nakulbaan ka, di ba? Grabe man yan. Nga pumping sa imong heart. And we also have your pulmonary condition. Yung mga lungs. Basi karon, nabudlayan ka naman ginhawa, may asthma ka, chances are mabira-bira man ang imong heart. Igapangita mo siya oxygen niya ipalapta sa imong lawas mo. Okay? So here are some of the normal values. Nagalain-lain ang heartbeats ng isa ka age group. For example, newborn. Usually, normal na sila ang 80 to 180 ka beat per minute. Okay? For newborn to 12 months, we have 80 to 140. Your toddlers, age 1 to 3, 90 to 140. For preschoolers, 3 to 6 years old, 80 to 110 beats per minute. For school ages, 6 to 12, they have 75 to 100 beats per minute. For adolescents like you, 12 to 19, normal heart rate nyo is 60 to 90 beats per minute. And for adults 20 and above, we have your 60 to 100 beats per minute. So as you can see, age variation also contains a specific range of normal pulse nga rate. Okay. So, paano ta mag-check pulse? Of course, we can use the simplest one, which is the palpation of the pulse points. We can also use your stethoscope kung may ara kita. Kaya sa mga hospital, kung kisa, they use the Doppler ultrasound device, your ECG or cardiac monitor, and your pulse oximeter. Pero dire lang tayo sa may palpation, matandog lang tayo sa mga pulse, pulse points. Okay? Next indicator of your vital signs is your respiratory rate. Okay, ang ato niya paginhawa. So we have first the term respiration. So it is the act of breathing. Okay, kung maginhawa kita, that is your respiration. When we take in air, that is your inhalation or your inspiration. And when we excrete or pinapagwata ang ato nga hangin, that is your exhalation or your expiration. So the process of inhaling and exhaling, pinapagwa, sudod ta, gwa, sudod ang ato nga mga hangin, that is now your ventilation. So gina-check ta kung effective ang pagginhawa niya or ang iyang pag-ventilation. Okay, ang pag-ventilate. So, paano ito mabalaan nga normal ang pagginhawa sa isang katawo? If the breathing is effortless, quiet, spontaneous, and regular. Wala daya sound nga do ginahapo, nga do ginahagal. Okay, so it is quiet and effortless. And also, your respiratory rate or your breathing rate depends on the age level or age group. So, here are your normal respiratory rate. For newborn, we have 30 to 60 breaths per minute. For toddlers, we have 25 to 32. For a child, we have 20 to 30. For adolescents, we have your 16 to 19. And for 21 above, we have your 12 to 20 breaths per minute. So, ang ating pagginhawa may also be affected in various factors. For example, we have the age. So, as you can see kagina sa mga normal values, galain-lain ang pagginhawa sa kada lain nga age group. Of course, when there is anxiety, kung na-anxious ka, matsyag mo, ginahapok ka, grabe pagginhawa mo. Same also with the activity if you have exercises or nagsaot-saot ka da. Okay? It changes your respiratory rate. Kung may ginabatsyag nga sakit, matsyag mong kisado, ginahawat-hawat man ang pagginhawa nimo. Or the body positioning also. May iban yun nga, do hindi sila kaginhawa. Kung nagahigda, daw malumos sila. So, usual nagatindog or nagapungko sila. Okay? For smokers, remember, smoking can affect your breathing, especially the effect of your nicotine and other harmful chemicals in your cigarette. Okay? Environment, for example, nagasaka ka sa babaw bukid, naganubo ang presence ng oxygen. So, chances are grabing pag ginhawa mo, galagas kasang ginhawa mo. The higher the altitude, the lower the oxygen. And also, we have your medications. Basta naman inom ka da nga budong or mga drugs mismo that will affect your breathing. Okay? So, we have now different terminologies related to breathing. So, when we talk about rate, ang kada sigun, sang imo nga paginhawa, we have first your takip niya. Maghamba kita takip niya, that is quick, shallow breaths. Hapaw nga paginhawa, pero dasig. Takip niya. Next, bradip niya. Maghamba kita bradip niya, there is abnormal, slow breathing. Kahinay sang iyang paginhawa, bradip niya. And we also have apnea or your cessation of breathing. Magamag kita, cessation, nagpundo ng iya paginhawa. Wala na siya gaginhawa, apnea. Next is we have your volume. Ang kadamuon sa ginhawa niya nga hangin. First, we have your hyperventilation. So, there is overexpansion of the lungs. Grabe nga pag-extend sa iya nga baga with rapid and deep breaths. Grabing panginhawa niya. So, anong ginahimo? Takong kisa sa mga tao nga grabing hyperventilation. Kwa, paper bag, tabon sa ilong. Magidugay, kabalik sa normal. We also have your hypoventilation. Magamba kita, hypoventilation naman, wala mayo nag-stretch iya nga lungs. Hapaw lang paginhawa niya. Okay, duga mo lang na. Inhale, exhale. Inhale, exhale. Okay. And for the rhythm naman, ang patterns ang pangginhawa niya, we have your chain strokes. When we talk about chain strokes, there is rhythmic waxing and waning. So ano na siya? Mangginhawa siya kung kisa very deep to very shallow. Grabe nga, inhale, exhale, gulpi lang nag-inhale, exhale, and gulpi lang nag-temporary apnea, nagpundo. Tapos gulpi naman siya nga deep breathing, shallow breathing, apnea. Doon nag-utod-utod ang pagginhawa niya. Usually present for persons with stroke, congestive heart failure, iban gani kung kisa sa mga tagimatayon, duga waxing and waning na sila, or chain strokes. And we also have the terms dyspnea and orthopnea. When we talk about dyspnea, that is your difficult and labored breathing during which the individual has persistent unsatisfied need. Doon budlay yan sa magginhawa, or in short terms, there is difficulty in breathing. And magamba naman kita, orthopnea, the person only breathes when there is an upright sitting or standing position. Makaginhawa lang siya mayo kung nagapungko siya or nagatindog. Pero pahigda bala kay do ginalumos siya. Okay, that is your orthopnea. And last, we have your blood pressure. Also one of the indicators of your vital signs. So blood pressure class is a measure of the pressure exerted by the blood as it flows through your arteries. So because the blood moves in waves, there are two blood pressure measurements. Okay. First, we have your systolic pressure. Diba magwa kita BP, may ara kita 100/80. Excuse me. Diba usually mga amoy na ato niya reading. So magamba kita systolic, amo na siya ang sa babaw nga number, 100/. Amo na. So systolic is the pressure of the blood as a result of the contraction of the ventricles. That is the pressure of the wave of the height of the blood wave. So kada pusga sa aton nga heart, that is your systolic. And diastolic naman is pressure when the ventricles are at rest. Okay? So systolic naga-contract ang imong heart, diastolic mo naman naga-relax ang imong heart. So amo na siya ang mga pressures nga gina-monitor sa aton nga blood pressure, the systolic and your diastolic. So we have two terms lang or terminologies for BP. We have hypertension and we have hypotension. Kung taas ang iya nga BP, hypertension na siya. Kung nubo naman, we have hypotension. And usually class, the blood pressure also varies ang ilang normal range. Okay, so as you can see in the diagram, kung newborn siya, bago bata, 85/54 ang normal niya nga BP. We also have variations with the varying age groups. Pero kamo for example, as teenagers, normal yung nga BP is 120/80. Okay? Ang range na usually is 90/60 to 120/80. Magtaas na high blood na siya. Kung magnubo pagid sa 90/60, that is your hypotension. And for older adults, we have your 140/90. Age also is considered as a factor in the variation of your blood pressure. Okay? So that, I think, ends our discussion for anatomical regions and your vital signs. Okay? So, by our live synchronous class, we will present to you the methods on how to monitor your vital signs, and then after which, we will give you the remaining time for you to comply your exercise minor PT. So, instructions for your minor PT will also be given during our live synchronous class. Okay? So, that will be all for now. Thank you so much and see you on our live synchronous class. Bye!